How can epilepsy surgery impact memory and speech? Imagine a treatment that can stop seizures and change lives, but also has the potential to affect how we remember and communicate. That's what epilepsy surgery can do. It's often used for severe epilepsy that doesn't respond to medications, especially when seizures originate in the temporal lobe of the brain. The most common procedure is called temporal lobe resection, where part of the brain involved in seizure activity is removed. While many patients experience a significant reduction in seizures and improved quality of life, it's important to understand how this surgery can influence memory and speech. Memory can be affected because the temporal lobe houses critical structures like the hippocampus, which is essential for forming new memories. If the surgery involves removing or damaging parts of the hippocampus or nearby areas, patients might notice some decline in verbal memory, especially if the left side of the brain is involved. This can mean difficulty recalling words, names, or details. However, some patients actually experience better memory after surgery if their seizures are well controlled. Seizures and the medications used to treat them can impair memory, so reducing seizures can sometimes lead to memory improvements. Factors such as the size and location of the resection, as well as psychological health, can influence these outcomes. For example, depression can make memory complaints worse, even if the actual memory function remains stable. When it comes to speech, the risks depend on which side of the brain is operated on. For most people, the language centers are in the left hemisphere. If the surgery involves this dominant side, there's a higher chance of temporary or even lasting speech difficulties. Some patients may find it hard to find words or speak fluently right after surgery, but many recover with speech therapy and practice. Others might experience more persistent challenges, but with the right support, most can adapt and regain their communication skills over time. Managing these risks involves careful pre-surgical evaluation, including brain imaging and functional testing, to map out areas involved in memory and language. The goal is to remove the seizure focus while preserving as much function as possible. It's essential for patients to have honest discussions with their healthcare team about the potential impacts on memory and speech. Every individual's brain is different, and outcomes can vary widely. While epilepsy surgery offers hope for seizure control, understanding and preparing for possible changes in memory and speech helps ensure the best overall quality of life. Always consult with medical professionals to explore the options that are right for each person's unique situation.